Hey everybody, it's Dr. Troy Tape with Cedar South Chiropractic. Today's video I just wanted to demonstrate a few soft tissue therapies that we do in our office here. So if you're working on, I'm going to actually demonstrate on my own shoulder, but we do that on shoulder, neck, back. You can use it in many different ways. But if you've been in and seen me for treatment in the last 3 weeks, you may have heard me complaining about my shoulder issue. So I'm gonna do a little work on it, what I've been doing over the last few weeks just to try to get some relief. So first thing, the simplest thing we do is using the Hypervolt. It's basically a pneumatic vibro percussion type of tool. Most people that have been in recently, we've used this on your back, but you can also do it on the shoulders, the hips, the legs. Basically it's just that rapid percussion on the muscles to help loosen things up. Most patients love it. Helps loosen up the muscles so the adjustment is easier and more effective. But with soft tissue issues, problems, we use this for a couple of minutes in certain spots, just trying to relax those muscles through there. So that's the first step that I've been doing for myself, Hypervolt. The second thing is, it's called Instrument Assisted Soft Tissue Mobilization, IASTM. People are familiar with the term Graston. These are not technically Graston tools because I did not pay $3,000 to go to the Graston seminar to get these tools, but it's instrument assisted soft tissue mobilization. So with this, what we do is we put a little cream on the area that we need to work on. So I use this China gel. I'm gonna show off my guns. China gel therapy cream works great. It's kind of like a massage oil emollient, but it has arnica, menthol for soothing. Helps with the pain, but basically you're using these stainless steel instruments to just dig on the fibers of the muscle tissue, so it's myofascial release, and you're just trying to break up any scar tissue, adhesions in the muscle. For me, I feel it right through the deltoid and the front side of the shoulder. It's been giving me trouble with the big side posture adjustment over the last couple weeks, so I got to get this right so I can keep doing what I do. But again, with this, we just work on shoulders, neck, forearms, just anywhere there's some major adhesions in the muscle tone. And as I work on it, I can find some spots that are really irritated. It's not a lot of pressure, but it just really loosens it up. It's like a very focused, deep tissue massage. And we only do it a few minutes in a spot. Pretty much what I do is just work for a couple of minutes. You'll feel those sore spots. It'll loosen things up. You can already see I'm getting very red. But again, this cream that I'm using helps with pain as well. It's similar to Biofreeze, but I like it better. So do that for a few minutes, dig out those adhesions. That'll really help, and then I'll show you one more thing that I've been doing to help maintain this. All right, so the last thing I'm going to do to help support this muscle injury is use a little bit of Kinesio-Tape. So there's lots of different brands, Rock Tape, I like TheraBand, Dynamic Tape. This is just a small sample of TheraBand's tape. This is, don't try to tape yourself on your shoulder. It's not going to end up great, but basically you apply just the edge of it, kind of adhere it to a spot, and you want to follow a certain muscle pattern to support that muscle. In this case, I'm trying to get the anterior portion of the deltoid because that's where it's feeling the worst. And in this position, you just put a little bit of stretch on it. You're supposed to, there's different techniques, but I like to put that muscle in a shortened position. So basically I kind of contract it, bring it up. This is going to turn out bad, and then adhere the bottom. So then when that did not work out so good. There we go. Now we rub it on to activate the adhesive. So now when you're in a neutral position, you'll feel that little bit of tension on there. So it helps support your muscle. It's good for sprains, strains, just irritated spots. So, and the nice thing with this China gel therapy cream is I can tape right over it. I don't need to clean the skin too much. And there it is. That'll help support it. So I don't hopefully aggravate it more as I'm doing the big side posture adjustment, which is where I've been feeling it. So that's how I'm treating myself, but I'm also doing it on patients, but I figured I'd demonstrate on what I'm doing with my shoulder issue. So if you're having trouble, let us know, get in for an appointment, and we'll do everything we can to get you feeling better. Again, it's Dr. Troy with Cedar South Chiropractic. Thanks for watching.